delayed or denied last year. That's according to a new report from the Commonwealth Fund. In some cases, the report claims that denials even cause the health of patients to worsen due to a delay in care, and some patients even saying that they've avoided seeking care altogether. So, joining me now to discuss this report is Dr. Sachin Jain, the president and CEO of Scan Group and Scan Health Plan. Doctor, thank you so much for your time today. I think this is really important, and it's a staggering report. So, 1 in 5 adults with private health insurance reported that they were denied coverage of a doctor-recommended treatment last year. I'm curious, why is this happening?
I think it confirms what many of us experience in the healthcare system as patients and what many doctors experience in the course of prescribing care, which is that an insurance company can sometimes get in the way of the care that a patient is prescribed. I think the last thing a patient with cancer wants to hear is that their the care that their doctor prescribes them is not going to be authorized. And I think that there's a lot of good work that's underway in the insurance industry right now to fix it. But we have to actually acknowledge that there is a problem before we actually fix it. And I would say, it starts with just recognizing that a lot of denials happen uh, because people aren't necessarily submitting appropriate paperwork. And that's unfortunate. I think what we need to do is approve things for proactively. We need to use artificial intelligence to approve care, in real time to address the real time needs of patients and get into a world where insurance companies are partnering with patients to help them get their care as opposed to standing in the way of it.
Well, and let's talk about some of these broader financial consequences here. We're seeing 70% reporting higher household costs and more than 40% with accrued ongoing medical debt here.
Well, so many people lack what we call first dollar coverage these days, which is they have high deductibles. And this was a well-intentioned policy proposal that, many academics argued for 20, 30 years ago that we're now seeing in real time isn't working. When people actually have skin in the game, the idea was that if they actually were spending their own money, that they would make better healthcare decisions. But what we're seeing is that what's actually happening is that when people are spending their own money, they're oftentimes delaying care, and they're actually getting sicker in the process. And I think we have to reimagine health insurance to provide more first dollar coverage to people so that they aren't delaying necessary care.
Well, and Doc, I think the other thing that kind of stood out to me with this report is just how many people didn't know that they could appeal after a first denial here.
I mean, and that's important too. But the reality is that we shouldn't put sick people in the position of appealing care. The last thing that you want to be doing if you're a sick person or going through a medical journey is arguing with an insurance company about whether you can actually get your care or not. That's a sign of system failure. My view is that we have to reimagine the health insurance industry altogether. We actually have to help patients navigate their healthcare journeys when they do get sick or when they are starting to experience symptoms so that we can partner with them to get them to the right places where they can actually get the right care. Um, so, the model we have today, which is denying care on the other side of it, sometimes because it's unnecessary care, or sometimes because it's the wrong care, is the wrong model. We should be working alongside patients the first moment that they actually know that they have an issue or challenge, and ensure that we are partners in actually enabling their care. And that's the kind of reform we not need. We need to start seeing from the insurance industry, and that's the kind of thing that we're trying to do at Scan, the health plan that I lead in Southern California.
Okay. Dr. Jane, thank you so much for your time today.
Great to be with you. Thanks, Alex.